All right, so we talked about volume support ventilation and volume control ventilation. Those are our money makers. That's what we're gonna put most of our patients on. This ventilator has the ability to do some more complex ventilation modes. And the third one is PCV, or pressure control ventilation. So in contrast to VCV, or volume control ventilation, you tell the machine, I want this many breaths a minute with this tidal volume. So if you set your respiratory rate to 10 and you set your tidal volume to 300, the machine is gonna give 10 breaths a minute, and each breath is gonna be 300 mils, and it's not gonna ask any questions. It's just gonna power through that, and it's not gonna stop until you tell it to stop. Pressure control ventilation is different. So you don't put in anywhere here, there's no spot for pressure control ventilation to put in a mil. There's no volume that you ask the machine to give. You just tell the machine how high you want the inspiratory pressure to go to with each breath. So it's gonna be preset at 10 centimeters of water, which is basically when we give a positive pressure ventilation breath, we kind of want it to go to about 10 centimeters of water if you watch your pressure manometer. And so basically if we switch to this mode, what's gonna happen is the machine is gonna give however many mils it needs to for the pressure manometer to go to 10 centimeters of water. And it could vary from breath to breath. Like if the surgeon starts to lean on the chest, then you're gonna hit your pressure limit a lot quicker than if the chest is, nobody's leaning on the chest. So it can be variable, very dynamic depending upon what the situation is. But one time where you might find this helpful is if you have a dog who maybe has a pulmonary bulla and you don't want to cause any lung damage to that dog, you don't want to pop a bulla or anything, you might want to do pressure control ventilation so that you never go over 10 centimeters of water. But for most of our patients, we're going to stick to the VCV, the volume control ventilation. Okay, the last ventilation mode, which is really cool, is called SIMV. I love saying that word, SIMV. And it stands for synchronous intermittent mandatory ventilation. So if we had a patient that needed to be on a long-term ventilator, so a dog with tetanus or a dog that had a cervical disc that was having a hard time breathing, or a dog where maybe his phrenic nerve was cut in a thoracotomy, and so he might have some problems taking breaths on his own after surgery, and those patients might all need to go on a long-term ventilator for 24 hours. That's how we would typically ventilate those patients, is synchronous intermittent mandatory ventilation, or at least it's an option for long-term ventilator cases. What that means is that if the patient takes a breath, the machine is going to synchronize the breaths that you're asking it to give. So right now it's set to a respiratory rate of 10. It's going to try to synchronize the breaths that you're asking for with a patient-triggered breath. So what this does is try to help the patient breathe if they take a breath, and try to synchronize a ventilator breath with a patient-triggered breath so that you don't have ventilator asynchrony. But we probably won't use that function unless we use this machine as like a long-term ventilator case. That's it.